If you're struggling with nerve damage, you're in the right place. Today, we'll explore exactly how these herbs can support your nerve health and provide relief from pain. Did you know there are natural remedies that can significantly improve your nerve health? Stay tuned to find out more. These strategies are used by athletes and health experts to manage and deal with nerve damage. Sit back and relax as we dive into these powerful herbs. In the next 10 minutes, we'll explain exactly how they can benefit you. By the end of this video, you'll know exactly which herbs to use and how to implement them for fast results. So, let's get started. Chamomile. Chamomile is renowned for its calming and anti-inflammatory properties, making it an exceptional herbal remedy for nerve damage. This gentle yet powerful herb has been used in traditional medicine for centuries to treat a variety of ailments, particularly those related to inflammation and pain. The effectiveness of chamomile in alleviating neuropathic pain can be attributed to its rich content of flavonoids, specifically apigenin. Apigenin is a natural compound found in high concentrations in chamomile. Scientific studies have demonstrated that apigenin has significant anti-inflammatory and analgesic effects. A study published highlighted that apigenin effectively inhibits the production of inflammatory cytokines, which are proteins that play a crucial role in promoting inflammation. By targeting these inflammatory pathways, apigenin helps to reduce the inflammation that often exacerbates nerve pain. This makes chamomile particularly beneficial for conditions such as peripheral neuropathy, where pain and inflammation are prevalent symptoms. There are various ways to incorporate chamomile into your daily routine to reap its benefits. Drinking chamomile tea is one of the most popular and simple methods. Regular consumption of chamomile tea can help reduce pain levels and improve sleep patterns. Chamomile extracts, available in liquid or capsule form, can also be used for more concentrated doses. Consistent use of chamomile, whether as a tea or an extract, can significantly enhance overall well-being by mitigating pain and promoting relaxation. Peppermint. Peppermint is another powerful herb that offers substantial benefits for nerve health, particularly in soothing nerve disorders. The primary component responsible for peppermint's therapeutic effects is menthol, which is known for its ability to provide a cooling sensation and relieve pain. This herb has been extensively studied for its efficacy in treating conditions characterized by nerve pain, such as neuropathy. Menthol, the main active ingredient in peppermint oil, works by activating cold-sensitive receptors in the skin, known as TRPM8 receptors. When these receptors are activated, they produce a cooling effect that can distract from the pain signals being sent to the brain. This mechanism is particularly effective for providing immediate relief from the burning and tingling sensations often associated with neuropathy. A study published in the Journal of Pain Research found that topical application of menthol significantly reduced pain intensity in patients with neuropathic pain, highlighting its potential as a natural pain reliever. To use peppermint for nerve pain, it is recommended to apply peppermint oil topically. However, it is important to dilute the oil with a carrier oil, such as coconut or olive oil, to prevent skin irritation. This can be done by mixing a few drops of peppermint oil with the carrier oil before massaging it into the affected areas. Alternatively, peppermint oil can be added to a warm bath, allowing its therapeutic properties to penetrate the skin and provide relief. Ginger. Ginger is a powerful herb well regarded for its anti-inflammatory and analgesic properties, making it an effective remedy for nerve damage and related pain. For centuries, ginger has been utilized in traditional medicine to treat a wide range of conditions, particularly those involving inflammation and pain. The active compounds in ginger, specifically gingerols and shajails, are primarily responsible for its therapeutic effects. Scientific research has extensively studied the anti-inflammatory and analgesic properties of ginger. Gingerols, the major bioactive components of ginger, have been shown to possess potent anti-inflammatory and antioxidant effects. A study published in the Journal of Pain demonstrated that ginger extract significantly reduced inflammation and pain in patients with osteoarthritis. The researchers found that gingerols inhibit the production of pro-inflammatory cytokines and chemokines at the cellular level, which are key mediators of inflammation. By reducing these inflammatory markers, ginger helps alleviate pain and discomfort associated with nerve damage. In addition to its anti-inflammatory effects, ginger also has analgesic properties similar to those of non-steroidal anti-inflammatory drugs, NSAIDs, but without the common side effects associated with these medications. This makes ginger a safer alternative for long-term use, especially for individuals dealing with chronic pain conditions like diabetic neuropathy. The analgesic effects of ginger are believed to be a result from its ability to inhibit the synthesis of prostaglandins, which are lipid compounds that contribute to pain and inflammation. Incorporating ginger into your diet is a simple and effective way to benefit from its medicinal properties. Fresh ginger can be added to teas, smoothies, and meals to provide a daily dose of its anti-inflammatory and analgesic benefits. For more targeted relief, ginger supplements are available in capsule form, offering a concentrated dose of its active compounds. Additionally, topical gels containing ginger extract can be applied directly to the areas of pain, providing localized relief from inflammation and discomfort. Ashwagandha. Ashwagandha is a revered herb in Ayurvedic medicine, known for its remarkable adaptogenic properties. Adaptogens are natural substances that help the body adapt to stress and exert a normalizing effect on bodily processes. Ashwagandha stands out for its ability to enhance the body's resilience in dealing with both physical and emotional stress, making it particularly beneficial for individuals suffering from nerve damage. Ashwagandha's anti-inflammatory effects also play a significant role in its ability to alleviate pain related to nerve damage. Research has shown that ashwagandha reduces levels of inflammatory markers such as C-reactive protein, CRP, and interleukin-6, IL-6, which are often elevated in individuals with chronic pain conditions. By reducing inflammation around damaged nerves, ashwagandha helps decrease discomfort and enhance mobility, making daily activities less challenging for those affected by neuropathy. There are various forms of ashwagandha supplements available, including capsules, powders, and tinctures. Regular use of ashwagandha can significantly contribute to nerve repair and overall well-being. It is recommended to consult with a healthcare provider to determine the appropriate dosage and form of ashwagandha that best suits your needs. Gingko biloba. Gingko biloba is a venerable herb with a long history of use in traditional Chinese medicine, primarily recognized for its ability to enhance circulation and protect nerve cells. The unique properties of Gingko biloba make it a valuable herb for supporting nerve health, particularly in conditions where poor circulation exacerbates symptoms of nerve damage. Gingko biloba is rich in antioxidants, which play a crucial role in protecting nerve cells from oxidative stress. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body, leading to nerve damage. The antioxidants found in Gingko biloba, such as flavonoids and terpenoids, help neutralize free radicals, thereby preventing damage to nerve cells. Research published in the Journal of Ethnopharmacology found that these antioxidants not only protect against oxidative stress, but also enhance the overall health of neurons, supporting better nerve function and resilience. Regular use of Gingko biloba supplements can provide these benefits. The supplements are available in various forms, including tablets, capsules, and liquid extracts. Consistent intake under the guidance of a healthcare provider can help enhance circulation, protect nerve cells, and accelerate the healing of nerve damage, making Gingko biloba a top choice for natural nerve health support. St. John's wort. St. John's wort is widely known for its antidepressant properties, but it also offers significant benefits for nerve health, particularly in promoting nerve regeneration and alleviating pain. This herb has a rich history in herbal medicine for treating various nervous system disorders, making it a valuable remedy for neuropathic pain. St. John's wort contains active compounds such as hypericin and hyperforin, which are believed to support nerve tissue growth and health. These compounds help stimulate the repair of damaged nerve cells and enhance their function. A study published in the Journal of Pharmacological Research highlighted that hypericin and hyperforin promote the regeneration of nerve tissues, making St. John's wort an effective herb for treating neuropathy. This regenerative effect is crucial for alleviating symptoms such as pain and numbness that are commonly associated with the nerve damage. Moreover, St. John's wort has been shown to exert its pain-relieving effects through anti-inflammatory properties and its ability to modulate neurotransmitter activity. Neurotransmitters such as serotonin and dopamine play key roles in pain perception, and by adjusting their levels, St. John's wort helps reduce the sensation of pain. Research in the Journal of Pain Research indicated that patients using St. John's wort reported significant relief from neuropathic pain, underlying its potential as a natural analgesic. St. John's wort can be taken in various forms, including capsules, teas, or tinctures. However, it is important to consult with a healthcare provider before starting any new treatment. as St. John's wort can interact with several medications and may not be suitable for everyone. Turmeric. Turmeric is not just a staple in culinary creations, but also a super herb in the realm of medicinal herbs, particularly for combating inflammation and nerve pain. The magic ingredient in turmeric is curcumin, a compound that has received considerable attention for its potent anti-inflammatory and pain-relieving properties. Curcumin works by inhibiting key enzymes and proteins that propagate inflammation throughout the body. This action is crucial in managing conditions like neuropathy, where inflammation can exacerbate nerve pain and lead to further nerve damage. A study published in the Journal of Alternative and Complementary Medicine found that curcumin effectively reduced inflammation in patients with rheumatoid arthritis, a condition that shares similar inflammatory pathways with neuropathy. By reducing inflammation, curcumin helps alleviate the painful symptoms associated with nerve damage, providing much-needed relief. Incorporating turmeric into your diet can be as simple as adding it to your meals or enjoying it in teas. Turmeric supplements are also available in capsule form for a more concentrated dose. For those dealing with nerve damage, regular inclusion of turmeric can significantly enhance nerve function and decrease pain, making it a top recommendation for natural nerve health support. We've covered 7 incredible herbs that can support nerve health: chamomile, peppermint, ginger, ashwagandha, Gingko biloba, St. John's wort, and turmeric. Implementing these herbs can help reduce pain, promote nerve repair, and improve overall nerve function. If you found this video helpful, please give it a thumbs up, share it, and subscribe to our channel for more health tips and natural remedies. Also, let us know in the comments which herb you're most excited to try, or if there's another you'd like to know more about.